Zoom host for today. Because we do have a packed schedule, we will start on time at 10 o'clock. Just a reminder, a few housekeeping items. Everyone will be muted as soon as the town hall meeting starts. Any questions you may have, please write them down in the chat box, and also please write the organization where you belong to. We would like to know where you which organization you are from. Also, just a reminder, this town hall will be recorded, and it's going to be streamed live via YouTube and Facebook, courtesy of our media sponsor, Lisa Ray from APIA News Network. So we still have 3 more minutes, so please enjoy, talk to each other, enjoy the music, and we will start exactly at 10 o'clock.
Thank you, Miriam.
You're welcome. I can find my...
I see President Smith.
Good morning.
Good morning, President.
Great to be sitting in this huge auditorium when I'm really in my front study here at the University House.
Again, please mute yourself until you're ready to speak.
Please just be mindful. If you're not speaking, please mute yourself.
Hi, just letting you know Stephanie Chang is on by phone.
Oh, hi. Oh, I just want to make sure. You still didn't have the power, Senator Chang?
No power.
Oh, no.
Oh, boy.
Good morning, everyone.
Morning.
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 Good morning, Millie. How are you?
I'm great, Bing. How are you?
I'm good. Thanks for joining us.
Absolutely. Thanks for having me.
All right. Exactly 10.
I'm going to go ahead and start.
Exactly 10 o'clock.
So I will start.
Good morning. Yes, good morning, everyone. Welcome to our town hall, virtual town hall again. I will turn over the Zoom podium to Dr. John Zoniga, who is going to be our master of ceremony. Unmute yourself. John, you have to unmute yourself.
I didn't call you. I was calling the doctor at home. We're trying to get you.
John, you have to unmute yourself.
Yeah. Oh, for a minute, can you go to your mom's room so I can change it?
Good morning, everyone.
I think, yeah. Okay, so
Good morning, everyone. Let me introduce our beloved President Jim Smith from Eastern Michigan University, and he's going to delivering the welcoming remarks. President Smith, please.
Good morning, Suyan. Good morning, everyone. Thank you for inviting me. A very important day, a very important set of topics. Not only am I with you today, my wife, Connie, who works in the foundation and does international relations, is joining to listen in as well. Bridge Magazine just yesterday, some of you may have seen, defined today's environment as a collusion collision of crises. And we see that with race. We see it obviously with COVID. We see it with socioeconomic insecurity, and we see it with health disparities. All of those topics will be part of today's discussion and certainly extremely timely. I want to thank the hosts for today's session. The three members of our faculty, I want to thank them deeply for their time in organizing sections of today's work. And I certainly want to thank our congressional leader, Debbie Dingell, who is with us, and our Lieutenant Governor, Garland Gilchrist, will be with us as well, our state representatives and our state senators. Many of you represent diverse groups of businesses and community organizations, and I thank you for being here as well. Some of you may know that as Eastern Michigan University went into a series of shutdown to semi-shutdown activities, I was able to provide updates initially on a daily basis with relationship to the COVID-19 crisis, information about campus activities and general health and wellness. One of my very first messages was on January 31st, where I noted that the coronavirus is a travel-related illness, not an illness associated with Chinese or the Asian community members. I followed up that comment with a quote from the Washtenaw County Health Department that said, "Let's fight public health concerns with compassion and science, not fear and discrimination." That was almost 5 months ago, and obviously what we had hoped for did not quite materialize as I believe it should, and I'm certain all of us who are on this video conference today felt like it should. It's not a new issue. Racism, as we're going to talk about in one of the first breakout sessions, Asian racism is not a new issue. I tried to think yesterday as I was writing my notes what I might bring forward as a salient point on Asian racism. And I thought back to 40 years ago, Vincent Chin, age 27 in Highland Park, coming away from a bachelor party, being killed, beaten by two white men who never served a day in jail. Obviously, that changed hate crime laws in America. It brought Asian discrimination and racism related to Asian Americans to the forefront. And I believe that EMU has listened. We're deeply concerned about internationalization and globalization. And you can only imagine the actions of the last 3 years, how those have curtailed what we've been able to do with our global community. The restriction on international students and students coming to us from Asia don't just affect our international students who want to study with us, it impacts all of us. All of our classrooms are better, deeper, and richer by having that global perspective. So we've continued to work hard, even as federal policies haven't always been on our side. Some of you will know the You Are Welcome Here campaign. We have over 100 banners in the city of Ypsilanti and on campus, recognizing our students from around the world and displaying not only their photo, but a flag of their home nation. 2 years ago, we launched the True EMU Global Rate, which was we were one of the first in the country to offer in-state tuition at the undergraduate level to students from any country in the world. And I proudly say that we are still one of very few universities in the United States doing that. We have expanded opportunities for our students to travel abroad as well, our domestic students to see the world. And I'm very proud of the fact that I've been able to travel to China 6 times, South Korea 3 times, Taiwan and Japan, all in efforts to build relationships with universities and governments in those countries. We can see that internationalization is an important part of our mission at Eastern Michigan University. And as I speak of our mission, we are beginning our new normal to begin back for fall classes. We plan to be in person. We plan to be with students and employees on our campus, probably in a more limited number, but we are keeping safety as a first priority. We'll be wearing masks. There'll be one-way entrances into and out of campus. There'll be one-way hallways, one-way walking hallways, and we will have proper physical distancing, hygiene, and other important safety messages. And we continue to work with our public safety group to do that. The last one that I'll mention about our new normal is some of you may have seen our announcement from 2 days ago that we have a single room guarantee now. Students who want to come to us and have fears of having a roommate because of the pandemic will be able to be in a single room. Every student who wants a single room, we will have that availability to them. And I would urge all of you, if you're interested in seeing how all of this pandemic activity is coming about on our campus, we have hashtag EMU-Safe, and I would encourage you to take a look at the work we're doing. Again, I thank you for the opportunity to be here today, and I believe I'm handing the video microphone over to Dr. Su-Yen Wu, who is a friend, a colleague, and doing some great work in Asian research. And actually, Su-Yen was with me on my trip to Taipei just a year or two ago, and certainly has been a leader in our work with Asian communities and doing phenomenal work. So thank you all very much.
Thank you. Thank you, President Smith, for, as always, your wonderful support for our team and for all of our work. Good morning. Can you hear me?
Yes, we can.
Cool. Good morning. Thank you for spending this lovely June Saturday morning with us. Since beginning of the year, coronavirus pandemic is affecting us in a new way, in many different ways, from economic instability, racism, and everything else in combination affect our physical and mental health. The structural racism and injustice like COVID-19 pandemic is a disease which are detriment to our health and well-being. So in everybody in the country, if not eradicated, will have long-lasting effects on us and our future generations. We are gathering here today to have an open and honest dialogue about the challenges as well as opportunities to move forward. During this action-driven town hall meeting today, this is the beginning. We are planting a seed in all three areas we are covering today: anti-Asian racism, economic impact, community and mental health, Eastern Michigan University Center for Health Disparity and Innovation Studies, along with statewide active coalition, are committed to work with all stakeholders after the town hall toward sustainable solutions in addressing these challenges ahead of us. Thank you all. Now I will have Roland Huang, the chair of Active Coalition, to start anti-Asian racism. Roland?
Thank you, Dr. Wu, and welcome everyone. I am the chair of the Asian Communities Toward Innovative Visionary Environment, that's ACTIVE. And in this session, we're going to be talking about the interaction between anti-Asian racism and the COVID pandemic. So we're going to define the issue, examine the reasons for this spike, and have some takeaways for action for the Active Coalition and all the participants here. And with that, I'd like to introduce our first panelist, Dr. Melissa Borja. She's an assistant professor in Asian Pacific Islander American Studies at the University of Michigan. So, Dr. Borja, let me pose a couple of questions. Can you identify the number of cases that have occurred during this COVID pandemic? And can you talk about your activities with the U of M task force? And can that translate into some actions that we can have as takeaways for the Active Coalition?
Thank you so much. Thank you so much. And good morning, everybody. It's so wonderful to be able to talk to you today about this important issue. I'd like to just make clear that I am a researcher with the Big Stop AAPI Hate Project, which is a national effort to document and analyze the scope of anti-Asian hate incidents during the pandemic. And we researchers have found that there has indeed been a surge in anti-Asian hate incidents. So I'm going to begin by talking about what we know about anti-Asian hate incidents and what different institutions of higher education can do to address it in their own communities. And finally, I'd like to talk about what city government and state government might be able to do to support Asian Americans during this time. So first of all, an overview of the situation to make sure everyone understands the pandemic has been associated with a rise in racist anti-Asian rhetoric because the coronavirus has been associated with Chinese and more broadly Asian people. We've seen this especially with elected officials referring to Wuhan flu or Chinese coronavirus. This has contributed to the stigmatization of Asian people. And we have not only seen an uptick in anti-Asian hate language, but real acts of violence targeting Asian Americans. So one of the most horrific incidents involved a Burmese American family that was stabbed, including a child under the age of 6 who was stabbed in Midland, Texas, because the person who stabbed them thought that that Asian American family was spreading the virus. The FBI has actually warned that we're going to see a continued rise of anti-Asian hate incidents because of the pandemic. And indeed, we also think that the possibility of rising anti-Asian hate is a problem also because of rising U.S. tensions, or rising tensions between the U.S. and China. The Stop API Hate Reporting Center received 1,500 reports in its first 4 weeks of existence. So this is a widespread problem. Reports are coming in from all across the country, and women are experiencing more hate or reporting more hate incidents than men. So there's a gendered aspect of well. What's notable is that our researchers have found that anti-Asian hate incidents have continued to increase even as people are staying at home and living under lockdown. So that's very concerning. And the possibility of these anti-Asian hate incidents rising is a real possibility because people are interacting more in public spaces now that lockdown policies are being lifted. Asian Americans have been organizing against this hate, and it's received a lot of support from different groups. So we've seen these incidents here in Michigan, customers complaining, for example, that they don't want Chinese hands on their food, Zoom meetings being interrupted with anti-Asian hate statements. And so these are problems that are occurring nationally, but also here in Michigan. So higher ed can be involved and government can be involved. I recommend that they have 3 goals. First, prevent the hate incidents. Second, reduce the harm of hate incidents. And third, make sure all people feel safe. Some of the things that both higher ed institutions and government institutions can do is some of the things that EMU has already done. For example, issuing a statement that makes clear that anti-Asian hate is out of keeping with the values of the institution and the community, making sure that students, faculty, and staff know how to report hate incidents, both to the university and to government institutions and other institutions. Making sure that Asian Americans have a seat at the table to help guide policy so that community leaders know what the concerns of Asian American people are. Continuing to provide active programming to make sure the community, whether we're talking about a university community or a broader community, they understand that racism is a problem, it continues to exist, that it affects Asian Americans, and that it takes active efforts to combat racism. And of course, finally, we need to make sure that our Asian American students and staff and faculty feel heard. They are vulnerable during this time. They need to feel safe in the university community. So active programming to support them. And finally, but not least important, perhaps most important, this is a time for Asian Americans to work in collaboration with other communities of color who are very vulnerable during this pandemic. So thank you. I'm happy to answer any questions related to my research and what we've been doing at the University of Michigan and other places during the Q&A.
Thank you. Let's hear from State Senator Stephanie Chang and the other panelists, then we'll get to questions. But let me pose a couple of questions to the State Senator. In terms of, from your lens as a legislator, can you talk about your ideas with respect to what's seeding this anti-Asian racism and what can ACTIV do to facilitate addressing the issue of this spike?
Sure. Well, thanks for having me on, and apologies that I am not on the Zoom, working on trying to resolve this power outage. But I am so glad that all of you are here for this really important conversation. And I think that this issue of increased stigma and hate related to COVID-19 is one that we have to keep talking about. And I definitely think that I would echo what Professor Borja actually just spoke about. I think that much of this is due to, well, I think a couple things. One, the words and actions of other elected officials, sort of inappropriately attributing a virus that doesn't have an ethnicity, because viruses don't have ethnicities, to Chinese people. I think it's obviously really inappropriate. And also, I think that we're even seeing candidates from both parties really not helping in this regard. So I think that is something that obviously we have to keep working on in really changing the rhetoric around this. But I think that one of the things that myself and Representative Krupa and other members of the Asian Pacific American Legislative Caucus have done that we have to keep doing is, holding events and sending out information. We early on, even before the first COVID case in Michigan hit, Representative Krupa and I put out a statement really trying to remind people to respect one another and to not fall into, fear mongering and scapegoating against Asian Americans or people of Asian descent. So, and then later on, we worked with Attorney General Dana Nessel and her team, as well as a number of you on this call, as community organizations, to actually hold a press conference and then later a town hall about hate crimes and knowing your rights and knowing who to call and what the phone numbers are for the Attorney General's hate crimes hotline, as well as the Michigan Department of Civil Rights and their hotline to report discrimination. And so I think that reporting is such a big part of the problem, in that we know that there have been incidents, but we have to really keep reminding people how important it is to report. So if you know someone who has experienced discrimination or hate crimes related to or potentially related to COVID-19, or just at all because of race or ethnicity, please call. And I apologize, I don't have the number right in front of me because, again, power outage. But I would really encourage you to reach out, because if we don't report these things, then it doesn't look like that it's happening. And I know that obviously we've got the Stop AAPI Hate, which is a national effort, but it's important that people see what's going on in Michigan as well. And when we think about Vincent Chin, and the, I think that story and very real pain that the community felt around then is, we don't want to see something like that happen again. So it's just really important to be vigilant, and especially as Professor Borja mentioned, that as people are starting to get out more to restaurants and shopping and just out doing normal life activities, as the stay home and safer at home orders have been lifted. I think it's just really, really important that we are watching out for one another, and again, reporting, because it's important to report, and then that's the only way to really help also keep perpetrators accountable as well.
Thank you, Senator Chang. Thank you, Senator Chang. By the way, that number, the hate crime number at the Attorney General's office, is 313-456-0200, 313-456-0200. Let's hear from State Representative Padma Krupa. Her district is Troy, and Clausen, and is really one of the areas that have a concentration of Asian Americans. And so do you have anything to add with respect to things that Active can do with respect to addressing any issues that might affect your community?
Thank you so much, Roland, and thank you to all the organizers in Eastern Michigan and Active for asking me to be part of this. I have heard from constituents who are facing hate crimes, and the thing that I will say is we must report. Only 3% of hate crimes are reported, and the inherent challenge as an Asian American, and I think Senator Chang said it a couple of years ago to me, is as Asian Americans, we have a tendency to accept and let it, we can't change other people's actions, we can change our reactions, and so not to react, but we must report. Because if we don't, we won't find a way to stop it. And so that number that it's in the chat window, if anybody missed it, please take it. We also have on our call here today, Assistant Attorney General Sunita Dardamani. We recorded our town hall that we did with her and with the FBI and the Michigan Department of Civil Rights. So anyone who's watching this, please go look on either Senator Chang's Facebook page or mine and find this this town hall that we did where we went into all the information. The other thing I would say is meet people where they are. For us as Asian Americans, if there is bias, it's like I walk into the Capitol, I only see one painting of a woman as a governor. If we really want to see more women in leadership, more of us have to put ourselves out there. And so maybe you're not ready to run for governor, but you should get involved in the local community. I think it's really important that you volunteer in your local community to make change there. So if there are some implicit biases, you address them with your neighbor right there. Go and get involved in PTA, go get involved in city government. I think those are really essential now more than ever.
Thank you, State Representative. I'd like to hear from Senator Runestad. Is Senator Runestad on the call?
Yes, I am. Can you hear me?
Certainly.
Okay, well, I'm very pleased at the opportunity to be here and listen to all of the comments about what's going on, particularly as we're dealing with this virus and discrimination that is going on in relation to this coronavirus. And what I've heard from a number of people is that there has been some unfortunate comments from both the presidential candidates, but also from other candidates. And I tell you what really bothered me enormously in the last campaign was to see how Senator Chang was characterized by her opponent in the primary. I haven't heard comments like that, I think, in any campaign I've seen that were anti-Asian comments that were just beyond the pale. I didn't see until I checked today to see if eventually she did apologize for those comments, the individual who made them, but that is just absolutely unacceptable. These kinds of behaviors cut across all racial categories in terms of who's capable of doing these absolutely unacceptable things that tear apart the fabric of our state and our nation. So I'm very pleased to be a party to the conversation here, and love these kinds of things because I always learn a lot from every single one of them.
Thank you, Senator Runestad. Just want to acknowledge that Senator Michael McDonald is on the line. Do you have anything to add?
Yeah, can you hear me?
Yep.
Oh, great.
Certainly.
Yeah, I was just saying I'm honored to be on this call. I've always been a big supporter of all communities, but particularly the Asian community. I have a huge constituent base in my district, which is Sterling Heights, Clinton Township, and Macomb Township. Been a big supporter, just listening. Anything you need from me, know that I'm there for you. I echo Senator Runestad's comments and Senator Chang's comments. I appreciate to work bipartisan because that's my district. So anything you need, let me know.
Thank you, Senator McDonald. Just to talk about next steps that we plan to proceed after the town hall meeting. As the state of Michigan opens up, the increase in public interaction may lead to more hate crimes targeting Asian Americans. It is crucial that Asian American business owners feel safe, and to address this problem, CHDIS proposes the Michigan Stay Safe initiative focused on protecting Asian Americans, while also establishing potential partnerships with the Attorney General Hate Crimes Unit and additional nonprofit organizations. This initiative will consist of a workshop led by Sunita Dodamani, who's with us from the Hate Crimes Unit of the Attorney General's Office, and also nonprofit organizational representatives to help business owners of restaurants, nail salons, and laundromats centered in the Detroit metropolitan area to learn about how to identify, respond to, and report racially motivated disturbances. We also plan to conduct interviews with APA business owners on their experiences with racism and hate incidents, and provide any support that they may need to deal with such incidents. And now I'd like to turn it over to Assistant Attorney General Sunita Dodamani for her comments.
Thank you, Roland. Good morning, everybody. So I'm Assistant Attorney General Sunita Dodamani. I am the Hate Crimes Unit at the Attorney General's Office. Dana Nessel instituted this unit last year. And just to be clear, a hate crime is any crime where a victim is targeted because of their race, their ethnicity, their national origin, their sexual orientation, their gender identity. These crimes are messaging crimes. They're crimes meant for an entire community. So even though you were hearing about incidents like the Burmese family in Texas, these incidents are happening in other places, but they have a profound effect on everyone. They are intended as messages to an entire community, which is why they're so divisive and they're so important to address. So at the Attorney General's Office, that's exactly what we're doing. So if you are the victim of a hate crime, it is so important to report, as Representative Koopa has said, as Senator Chang has said, the only 3% of hate crimes actually do get reported. And so Roland asked me to address not only, how to reach the Hate Crimes Unit, which the number I'm throwing in the chat, 313-456-0200, but you can also email us at hatecrimes@michigan.gov. And that's not just for reporting a hate crime, but anything you may need from the Hate Crimes Unit. Like Tapar is on the call right now from the Burma Center. We did a webinar for the Burma Center where we let people know about how to reach the unit, what the unit provides, the resources. So I encourage you to do that for any sort of thing you may need. It's hatecrimes@michigan.gov. Roland asked me to address not only hate incidents and how those can be reported, because that's the most important thing, is to actually report them, but also what can students do that are going back to school that are that may be experiencing hate incidents or bullying in school. And I just want to make you aware of a resource Michigan State Police has, which is the OK to Say program. It is an app that students can download onto their phone, where they can report incidents that they see, because oftentimes we know that at the ground level, students are seeing this, but they may not know who to tell. It's an app that you can put on your phone. It's confidential. It's not anonymous, but it is confidential. I'll just show it to you. I have my phone here. It's an app that you can download. And when you click on it, it opens up to a screen where you can report tips. And you can call a helpline. It has resources, and it allows you to submit tips to the Michigan State Police, which runs through their Michigan Intelligence Operations Center, and then gets disseminated to the appropriate source. So that's a resource for students to use. But I can't encourage you enough to actually report, because we need to know how to address these things. And these are messaging crimes. So we want to also message back that that's not okay in the state of Michigan. Thanks, Roland.
Thank you, Sunita. We're now at the Q&A point, and we don't have a lot of time, but I do have one question that's been posed. It is posed by a person who wears hijab and constantly feels unwelcome in her environment. And she's asking for what to do because she doesn't feel welcome in this environment. So I throw it to anyone on the panel to address that. Whether it's bystander intervention or what to do or say.
Oh, well, this is Senator Chang. I mean, I think that I would love to, I know that there has been, you know, so much sentiment, not necessarily even due to COVID, but just for years now, anti-Muslim sentiment. And I guess I would like to know more, I think, about specific circumstances. Sorry, the baby's going off. If there are times where you think that you have been discriminated against, like we've been saying, I think it's really important to report to the appropriate hotline. And if it's something where you feel uncomfortable in your workplace or at school, sorry, I don't know who left the comment, so not sure what your circumstances are. There are definitely protocols that should be, you know, things that could happen that we could help with ensuring that your school or your workplace, you know, is taking appropriate steps there. So I guess I would just say, if you want to follow up with one of us after with your specific, you know, specifics, then maybe we might be able to get a better handle on how we could help.
Thank you, State Senator Chang.
And I would like to add, Roland, also, people usually have bias when they have fear or it's something unknown. And so always, if it's good to find an ally, but also if you feel comfortable with someone, to have that conversation while you wear a hijab. I know that I understood from speaking with my Muslim friends who wore hijab, why they wore hijab. It helped me to better understand why they do it. And it just, not that I had any hate towards them, but being able to speak to why you do something, not that you have to justify it, but when somebody doesn't know, to make them understand where you're coming from, building that relationship with someone so that they don't hold that bias against you. I think that's really important.
If I could also jump in and add one thing, there's been a lot of emphasis in this conversation on reporting hate incidents when they occur. And that's really important for us to understand the types of hate incidents that are taking place. But we need to invest resources to make sure we're preventing the hate incidents in the first place. And this can involve a variety of things. It can involve personal interactions with people to improve understanding, community education efforts to emphasize the importance of rejecting hate. But we can also think about how we can, in our schools and in other institutions, proactively promote understanding of people who are different, promote ethnic studies education in both our schools and in other venues, so that people are actively welcoming people who are different.
Thank you, Dr. Borja. With that, I hand it off to Miriam for panel number 2. And thank you all on panel number 1. Thank you very much. Miriam?
Thank you, Roland. Good morning again. This is going to be this economic section of the virtual town hall. And before I turn it over to our moderator, I would like to introduce our speakers for this morning. Panelists and speakers, if I say your name, just say hi or hello to our audience for now. Our first speaker is the Regional Director for U.S. Senator Gary Peters, Chris Mattis. Chris, say hi.
Good morning.
Good morning, Chris. Our second speaker is the Executive Director of the Office of Global Michigan, Michigan Department of Labor and Economic Opportunity, Director Feiruz Saad. Director Saad, good morning. Our next speaker is the Vice President of Global Entrepreneurship and STEM Talent, Global Detroit, Ms. Millie Chu. Ms. Chu?
Good morning, everyone.
Hi, good morning. Our fourth speaker is a licensed banker from Citizens Bank, Mr. Stephen Zanetti. Mr. Zanetti? Stephen? I think he's here, but okay. We'll find him shortly. And our fifth speaker is the founder of myindia.com, Mr. Anand Kumar. Anand?
Good
I
morning.
see you. Good morning. And our last but not the least, our moderator for this session is the chair of the Asian Pacific American Chamber of Commerce, Mr. Bing Goy. Bing, take it away.
Thank you, Miriam, and good morning to all of you who have joined us in this town hall for this very important discussion. At this time, I would like to ask Anand to lead our presentation. Anand Kumar is the founder of My India. So Anand, please go ahead.
Thank you, Bing. I am very happy to be a part of today's town hall. I'd like to present to you 4 slides and talk about the economic impact of COVID-19 on the APA business community. As you all know, we are very well represented in the business community here, the APA. We have a number of industry verticals. We have a lot of restaurants. Healthcare is well represented with the doctors, physical therapy clinics, pharmacies, salons, spas, travel agents, hospitality, hotel, motel. And many of you may not know this, but 50% of the hotel, motel properties in America are run by APA, specifically the Indian community. Other retails, fashions, franchise, manufacturing, auto parts. It's a big part of our economy here in Michigan. And of course, information technology. We have several companies headquartered here in Michigan. And then religious and nonprofit organizations. So it's a very broad spectrum of our business communities impacted by COVID-19. Moving on to the next slide, just about a couple of weeks ago, we did a short survey. It's a smaller sample, but we talked to a few businesses in the area to assess the impact of, or the response rather to the stimulus plan. And our questions centered around the PPP program, paid paycheck protection program, and 17 businesses were surveyed. About 10 of them have been funded. And the general response was that the first round was very hard to get into. The second round is okay, but there's still some difficulty in fulfilling these applications. As far as some of the challenges the businesses are facing, rent. Most of these businesses are rented space, and they're having significant challenges with that. And of course, the revenue shortfall is a huge obstacle in their recovery process. Flipping on to slide number 3, and we have identified some of the pain points for businesses, and which really means serious challenges. The federal stimulus package, it helped, but not much. And part of the reason is a number of these small businesses, they don't necessarily run a payroll. They are independently owned, and they take a profit at the end of the year. So that's a challenge. And there are also difficulty in getting the payment PPP program, the loans. But like I mentioned, the second round is working out okay. And going forward, the rent, utilities are a challenge. And if this continues for even 3 months, we would assume that we expect that about 30% of the businesses will cease to exist. IT industry, this is very important for Michigan's economy. This is the high-paying tech jobs. There is a challenge with a number of visa program, the H-1B program. There's a number of challenges with that. So this is a serious issue. And then the other point is that a number of these businesses are looking at reconfiguring. So there's going to be a challenge with issues like funding to reconfigure the business. On the last slide, I have listed what is the ask. Businesses are looking for more grants, loans to reconfigure the business, financial consulting because the business model needs some tweaking and change. Language services is also an ask, and legal compliance advisory help, and finally, more relief from visa restrictions. This is very, very important as some of our folks are facing deportation. Just because they've been furloughed and they could use a lot of help on this aspect. Thank you for your time.
Thank you so much, Anand, and thank you for setting the stage for our other presenters to possibly address some of the concerns and the challenges that are being faced by APA business communities. So at this time, I would like to introduce our next speaker, which is Chris Mattis from the representative from the Senator Gary Peters' office. And Chris, the questions that we would like to have you address are, what are some of the grants available at the federal level to assist small APA businesses to stay afloat? And is there any discussion at the federal level about relief from visa restrictions among APA business owners? Chris?
Sure. Well, hey, good afternoon. Is it afternoon? Oh, good morning still. Sorry, forgive me. Good morning. I'm really happy to be here. Thanks for giving me the opportunity to participate on behalf of Senator Gary Peters. And forgive me, I'm going to put my little stopwatch here. I don't want to take up too much time. But yeah, thank you. No, very happy to be here. And certainly, as you know, Senator Peters is ranking member on the Homeland Security and Governmental Affairs Committee. And that, of course, gives him an opportunity to really be there as part of the conversation on quite a number of the issues that are pressing today. I know you're asking about visas, and there's also been some concerns about help for small businesses. But super quickly, if I may, I just wanted to also highlight that part of that ranking member role on the Homeland Security and Governmental Affairs Committee is oversight. So that also includes the need for criminal justice reform and an honest discussion on the threat of white supremacy and its role in domestic terrorism and the concerns of minority nonprofits and faith-based institutions when it comes to security. So Senator Peters takes that responsibility very, very importantly. In addition to other things that we don't need to get into because time is short, I understand, but happy to answer questions. He is working to get a national criminal justice commission at the federal level reinstated, which would bring voices from civil rights groups, law enforcement, social service providers, to talk about ways and improvements. And the last time that happened was way back in 1965, and some of the things that came out of that, for example, as I understand it, are like the 911 emergency system. So finding ways to improve the systems we have at hand and promote really community-focused, community-rooted, homegrown police departments is something that Senator Peters is really excited, or excited maybe too positive of a term, but he understands the necessity of addressing that. So Senator Peters, of course, is also on the Senate Commerce Committee, which certainly is important when it comes to his advocacy for Michigan businesses, small businesses in particular, but also larger manufacturers, auto supply companies. I know he has joined an effort, perhaps you all were able to see, but he had joined an effort along with Congresswoman Stevens, Congressman Upton, in leading a delegation letter to the Department of Treasury, talking about some more flexibility and support when it comes to supporting the auto industry. So he's also working with Senator Stabenow and others in Congress. It seems like it's working, it's gotten better, but he was definitely focused and concerned about the rough and frankly disappointing rollout of the programs like the Paycheck Protection Program. I hear and can appreciate how it has been challenging. Not all businesses operate the same way. Not all employees are paid the same way or compensated the same way. So, certainly happy that there seems to be some improvement to that program, but, also that's why Senator Peters really pushed in the initial CARES Act and continues to push for kind of a more expansive understanding of who can apply for unemployment benefits. So small business owners, independent contractors, gig workers, those groups who maybe traditionally haven't been eligible or maybe haven't really had the support to know how to engage in those bureaucracies, those programs. And in the theme of that, one thing that made Senator Peters really concerned in the theme of oversight there in the Homeland Security Committee was that Michigan's the 10th most populous state, but it received, as I understand it, something like 35th, 37th in terms of funding for small businesses in that initial CARES Act funding distribution. And that's something that's certainly a concern for Senator Peters. And he introduced the Community Capital Investment Act, which would establish a Treasury Department program to provide community investment institutions, such as community development financial institutions, minority depository institutions, these community banks, credit unions, local organizations that all small businesses, particularly businesses in perhaps historically underserved communities, access to critical investment. And my understanding is that recently the Treasury Department and the Small Business Administration did announce that they will set aside $10 billion for these community development financial institutions, which is good. So as far as grants go, there is, I will admit, when it comes to a small business perspective, I do think the best way to engage at this moment is through those community banks and those financial institutions. And I know that, unfortunately, as I said, the program highlighted some bumps and struggles, some unfair access issues and unequal access, but hopefully those are being addressed. And I see I'm running out of time. There's so many things I wanted to talk about, including looking at this also as making sure FEMA is addressing to emergencies and disasters in a fair way in all communities. So looking at how to encourage inclusive responses to disasters and aid at that level.
Thank you, Chris.
Sorry, real quick. I know I've gone. Oh, sorry.
True.
No, go ahead. I just wanted to say, as far as visas go, admittedly, it's not front of mind right now in Senator Peters' office, but I did want to do a plug for, he does have a casework team in immigration, in particular, 2 caseworkers who focus on those issues. They're issue experts and they're happy to be helpful. So if you or anyone in the community is having trouble, a business owner or a family member with the immigration process, getting the workers you need for your businesses, please, I'm going to put my contact information and keep in touch. And I will always happily get you in touch, whether it's Alex or Zaina or Senator Peters' legislative team. Let's keep the conversation going and be helpful where we can. But admittedly, I do not know. It doesn't seem like there's an conversation in Senator Peters' office right now, one way or the other. He certainly is for reasonable and thoughtful immigration policies. Anyway, forgive me. I've gone on and on.
Okay, Chris, can I just ask you to at some point respond to this particular question that was raised to us by one of our guests? And then the question is this: how can you help end country-based discrimination while issuing green cards in employment-based green cards? So if you could kind of send us maybe some information about that and how Senator Peters can help us.
Sure. I would. I'm certainly happy to do that. And I don't know if perhaps if this is in reference, I know there's been some legislation around, like, for example, we've been hearing a lot in the office regarding Senate Bill 386 and ways to kind of revamp the way the H-1B visas have been handed out. And so I can certainly say that the office is aware, and I can send out an updated, maybe Miriam, if that's great to direct it to you, and you can, or distribute it, whoever needs it. But I'll touch base with Alex and get the latest as far as where Senator Peters is. I know he hasn't signed on as a co-sponsor, in particular to that particular piece of legislation.
Thank you, Chris. We will now go to the Director of Global Michigan, Ms. Beru Saad, and she will be, we will ask her to answer the questions based on what workplace safety guidelines and expectations coming from the state and other more prudent information can you share with our guests?
Yeah, thank you, Bing, and good morning, everyone. I am really privileged to be here with you all. I wish it were under better conditions and circumstances, but really quick, for those of you that don't know, I want to introduce the office to you. So the Office of Global Michigan, which is in the Department of Labor and Economic Opportunity, but was stood up by the governor, and many of you might know it formerly as the Michigan Office of New Americans, which of course Bing was the first director of. So our office is essentially directed by the governor to lead on immigration policy and immigrant integration efforts across the state. For immigrants, new Americans, refugees, so on and so forth. And so our office essentially works across state government, even though we are in the labor department, to help ensure that our communities get the information and resources that they need. So to that end, during the crisis, we have been coordinating all the governor's executive orders and information coming from the executive office related to the COVID-19 response, and ensuring that they're translated into a number up to 6 different languages. So for those of you that need those resources, please go to the COVID-19 website and you should find them. So there's a couple of programs that I want to quickly talk to you about today, and I'm going to be reading off talking points. So Bing, feel free just to interrupt me if I don't see you. Give me my time notice. The first program is something called the WorkShare program. And this is important for small business owners and to a certain degree employees as well. So the expanded WorkShare program helps employers bring back workers from unemployment and restart their operation. So as Michigan businesses begin to reopen, this offers employers some leverage and an ability to either bring employees back from unemployment or retain their skilled workforce. So the Governor Whitmer's recent executive order offers employers greater flexibility as they restart their businesses and bring employers back from unemployment. Employers can reduce hours to their employees by as little as 10% and as much as 60%. And there will be, and there's no time requirement that employers have to use. And it allows the employees to collect unemployment insurance during, what would be considered a furlough time off during the week. In addition to that, they would also collect the $600 federal employment in the pandemic unemployment assistance through the CARES Act. And I believe this is through July 2020. So there's only a little bit left in terms of the PUA, additional $600. However, the WorkShare program is a program that you apply to through the state of Michigan. So how you apply, the application process is simple. You go to michigan.gov/UIA. You log into your employer MYM account. You follow the steps, you create a plan, you upload your employer's information, and there's tutorials on there and FAQs and everything that you might need to be able to apply. So that's just a quick overview of that WorkShare program, because I also, and I can answer questions later, but I also want to talk about kind of what's coming out of the state in terms of workplace safety and what's expected of employers as we return to work. So the governor issued an executive order that requires businesses to provide COVID-19 training to workers that covers at a minimum workplace infection control practices, the proper use of PPE, steps workers must take to notify the businesses or operation of any symptoms of COVID-19, of a suspected or confirmed diagnosis of COVID-19. So if employers hear about an employee that was infected or came back with a positive test, how they must notify other employees within their operations, and then how to report unsafe working conditions. So
can you kind of summarize it up now?
Sure. So you could go to the COVID, so michigan.gov/COVID workplace safety has all the information on there from MIOSHA that really outlines what employers need to do in order to make sure they're compliant with standards. And it does offer a template that you can use for your businesses, and all businesses are required to have a work plan in place. And so that template is about 8 pages, and it is translated into 3 languages, Arabic, Spanish, and simplified Chinese.
Thank you so much, Beiruz, for that information. And again, please submit your questions. I already have 2 that we will be discussing in our Q&A time after the last presentation. Now I would like to introduce Millie Chu, who will represent Global Detroit. And Millie, the question that we would like to have you address is this: are there any available support/resources your organization, Global Detroit, offers to assist APA businesses to reconfigure their business model? For example, business and financial consulting, language translation services, and/or legal compliance advisory help. Millie?
Yes, absolutely. Thank you so much for this question, Bing. First, I'd like to say that through the COVID-19 pandemic and the appalling racism we've seen and experienced, and all the suffering that the businesses had to go through, this has created obviously many disheartening challenges for Michigan, our nation, and the world. So I feel like this is a crucial time for us to work in unity. And it's my desire that all who are listening and the speakers here today continue to pool our knowledge, expertise, and passion together to be a force to fight against oppression, systemic racism, and share our knowledge and resources and economic development to unite and also drive our community forward. So for those who are maybe not as familiar with Global Detroit, Global Detroit is a regional economic development and community development organization. With a focus on immigrants and global talent, we develop and implement inclusive strategies to drive growth, revitalization, and also shared prosperity of Detroit and Southeast Michigan. So we know that immigrant inclusion is critical to Detroit's revitalization and our region's growth. Immigrants have founded 51% of US startups that are valued at 1 billion or more. And in Michigan, 20% of Main Street business owners are immigrants, generating 1.3 billion annually. So we help high growth startups with foreign-born founders stay and create jobs in Southeast Michigan. And we connect small business owners in Detroit's immigrant neighborhoods to the city's extensive ecosystem of funding and the support that they need to really put down roots and thrive. So we're known as trusted connectors. We value and utilize the fact that connections are the key to making our work happen. So as trusted connectors, we have an extensive network of referral partners and providers whom we co-create, collaborate with, and work as a team to help APA communities and other immigrants to thrive. So in the areas of business and financial consulting that you mentioned, Bing, we assist them with navigating through local, regional, and federal programs and connect them to our wide network of providers. So for example, we collaborate with organizations such as Michigan SBDC, TechTown, Accounting Aid, Society, amongst many, many others who have been amazing partners to work with as we work together to assist businesses. And although we are trusted connectors, when COVID-19 actually set foot in Michigan, my team immediately pivoted in less than 24 hours and added on direct consulting to aid in this time of need. And we recognize that in a time of crisis, I call it actually the 3 A's, we must be agile, adaptive, and quick. So we utilize strengths and skills of our people to assist the community in further ways. As an example, one of our staff had 10 years working as a teacher in universities in China. We encouraged her to pivot and begin coaching international students during the crisis. Myself, having served previously as a business consultant for the Michigan SBDC, I used that skill set and reignited consulting small businesses in sustainability, development, and financial coaching. So those are just a couple quick examples out of our several pivots. So my team can communicate in Mandarin Chinese and Cantonese Chinese. And for translation services, we actually lean on outsourced providers and industry partners with strengths in translation. And so we know what we do best, what we don't do, and what others know. So that is really speaks to our network that we have and develop relationships with. So partners such as the Association of Chinese Americans and Detroit have been instrumental in teaming up with us and translating important information amongst many others. So through this community collaboration and many others, and our COVID-19 resource page at globaldetroitmichigan.org lists translated material available in Chinese, Arabic, Bangla, Spanish, and of course, English. So we're often actually asked to provide legal advice. So we are not attorneys, first of all, and we cannot practice law, but we are delighted to have several law firms and partners to do. So our trusted legal partners such as Precori Global, Miller Canfield, Butzel Long, LegalPad, and others have provided legal guidance for immigrant business owners that we can connect you to.
Millie, can you please wind up your presentation for right now, please?
Absolutely. So lastly, because of our expertise and wide network that I just shared with you as trusted connectors, we are a really good starting point if you are an immigrant or APA-owned business. If it is not something that we do, we often know who does and connect you with the right person or organization. So we really thrive on being nimble and adaptive and responding to the needs of our community. And we look forward to helping you. Thank you.
Thank you. Thank you, Millie. And now, Mr. Steven Sunetti, are you with us? Oh, there you are.
Yes, good morning. Can you hear me, sir?
Yes, we can. And
absolutely.
We'd just like to have you address for 3 minutes what have you observed from APA business at PPP applications, and what any advice you can give us in terms of how to fill these out and what next steps we should take in order to be successful in those application process.
Absolutely. So the Payment Protection Program was originally the first round of funding. We do have a second round of additional funding of $175 billion. The demand for the Payment Protection Program is very strong. Right now, it looks like June 30th of 2020 will be the last time anybody can apply for the Payment Protection Program as of right now. And at Citizens Bank, we are closing ours June 17th, just so we can take our full interest into those accounts as well. With the PPP borrowers, there is actually some new changes to that as well. To choose to extend the 8-week period of the payments to a 24-week period. Based on Flexibility Act, it was 75% can go towards payroll to be forgiven. Now it's 60% as well. For my advice as well to keep the businesses more successful, more strategies, is working with your bankers, your business bankers there. We can tailor around you to see what is needed. In order to be successful that way, Mark Cuban said it best: diversify your options. You can get to lending from only one bank, but you can apply to multiple. So apply to multiple financial institutions in order to receive the loan. Some people there's backup. Some institutions might have more than others. I've seen where we've been able to help people that have applied to different ones, and some people went to other institutions. So to make sure just to get out there, apply to several other financial institutions, credit unions, banks, anything of that nature, just to kind of make sure that you can secure some funding to not only help your business strive, but help your employees as well. Also, some more advice is checking your application status daily, minutes, every 10, 15 minutes, check your email, because it can come in and we want to secure the funding right away. With that being said, check your junk mail. I've seen a lot of it where junk and spam mail to go to sign the documents as well. Now, if you're not going to sign, when you're going to sign the documents to receive the funding, sometimes it gets sent to the junk or your spam mail. Unfortunately, we don't know why, and it's been happening with the SBA as well. So check that, because a lot of times when we come in, we invite our clients in on a basis that we're seeing it's getting sent to their junk or spam email. So we need to make sure that we can kind of follow that as well to kind of go over that. I'm seeing you mentioned it was extended from 8 weeks to 24 weeks. It is 24 weeks currently to the end of this year, the calendar year of 2020. And borrowers now have 5 years to repay this loan instead of the 2 years originally. That was, but it's still at the 1% annual percentage yield also.
Great. Thank you so much. That's good information. And just for all of our guests, we will be holding another town hall meeting in which Stephen and Citizens Bank will participate in, that will go into a more in-depth detail of the PPP program and how to apply for it. So thank you so much.
I just want to share one more thing. I just actually sent our application link down there to any of our small businesses that are out there currently. Since June 17th is our last day, we are accepting applications. I want to make sure that everybody can look there at that link, and it'll kind of show you a general rundown of what is needed as well.
All right. So for all of you, please go to your chat box and you can see the link for Citizens Banks to apply for the PPP loan. And they do have a June 17 or 16 deadline, but other banks may have, other financial institutions may have deadline can apply for. There is also on the chat box, Farusad has given us the link that will give us more information regarding the Workshare program and other programs regarding workplace safety. So please check your chat box and then and take down that information. There are other questions that we have here. Let me see, make sure. We've addressed the one about the green cards, the links to the Workshare program. The 28th from 8 weeks to 24 weeks, that's been answered. Mrs. Zanetti has done his, given us his link as well. So I don't see any other questions. Jessica, am I missing anyone? Oh, I'm sorry, a question for Chris Mattis. Chris, are there any legislations or policies being discussed that targets the APA business communities directly?
Honestly, I don't believe there's anything that is targeting the Asian Pacific community specifically. I can follow up and see, but truth be told, I think a lot of it from the federal side is a little bit. But yeah, the only thing I was thinking through is maybe through some of the different nonprofits or faith-based communities, there may be an opportunity to engage there. But I would love to have the conversation. Please, if there's ideas or entities that you believe aren't getting a fair shake, let me know and let's flag it so we can fine tune that still and make sure it's getting where it needs to be.
That's awesome. And for all of you who are our guests at this town hall meeting, please send your questions to Miriam and or Dr. Wu, and they will certainly be able to respond to you with the appropriate information. I have one more question for Millie Chu. How do you encourage or what advice do you give young APA entrepreneurs who would like to start their business during this uncertain time?
Yeah, thank you. This is a great question.
You have 1 minute though.
Okay, so all things considered. Okay, so I'll try to speak fast. I believe actually this is an actual opportune time for APA entrepreneurs to start or begin putting their pieces together for building a business. You know, the greatest innovations surface actually out of tragedy and global crisis. You know, there's tons of like examples, you know, with the development of the printing press, the light bulb, and photocopier, super glue, jet engine, the microwave, you know, you name it. So I'm personally actually excited, despite, you know, of course, all the circumstances, to see the greatest minds rise and propel our world into a new era of innovation. So I would suggest them to stay alert on the industry, study the past, the present, analyze patterns, utilize predictive science, and ask how your idea can be a solution to a problem or be able to fill a gap. So really do your research and be agile to economic shifts and changes. If you have that product, idea, or service, begin putting it on a business roadmap, whatever that may be for you, a business plan, business model canvas, a slide deck, and this would contain things like market feasibility and analysis, financial consideration and requirements, the team that you may need to bring this into fruition amongst many other factors as well. So you'll find that you'll have an idea that has multiple parts, but once you start putting this roadmap together, you'll have a better perspective on what your next steps are, how to execute it, and perhaps discover like better ways to do what you want to do. And most of all, enjoy the journey. Thank you.
Thank you, Millie. Thank you to all of our panelists who have given their contact information, and so please, for additional questions, please contact them through their contact information that is contained in your chat box. And now I will turn it over to Dr. Su-Yin Wu.
Actually, let me just introduce them, Bing. Thank you, Bing, for a very informative discussion. We certainly have a lot of information in the chat box. Our next session will be on community and mental health, and I'm not sure if Dr. Soniga's audio is working. John, is your audio working?
Can you hear me?
Yes, perfect. Take it over, Dr. Soniga.
Well, thank you, Miriam. We now move to a conversation on the third panel about the impact of COVID-19 on community health, including in particular the mental health aspects, of which we see discrimination and economics impacts are salient. There are several dimensions we'd like to think about in discussing COVID-19 and health outcomes. One is the need for disaggregated data on health to identify groups that may have a higher likelihood to get sick or experience more severe illness from COVID-19 as the pandemic progresses. The current data that we usually have in this field list Asians as one homogeneous group, and this will not show us how different subgroups have increased risks. For example, I believe it's Lansing's zip code 48911, where the prevalence of COVID-19 for Asians in that community are 4 times higher than whites, while blacks were 3 times higher than whites. So when we get that detailed data, we have more information. Another factor we'd like to consider is the cultural values and the common misperceptions and lack of language appropriate resources in Asian Pacific American communities that often prevent individuals facing mental health challenges from seeking support. We don't have that available right now in many communities, and in particular with an increase in hate crimes that we noticed in the first panel against APA communities during the COVID-19 pandemic. Existing mental health challenges are exacerbated, and we have a much greater need put upon us. And finally, the need to proactively enact prevention strategies to prevent future unnecessary COVID-19 infection now and to forestall the next outbreak among essential workers in particular. For example, several APA community groups are primarily employed in meatpacking communities and in healthcare, and we need to be proactive in getting a handle on the next wave for COVID-19. So I'd like to now turn things over to Dr. Su-Yin Wu to introduce our panelists for this final segment.
Thank you, John, for giving this a very comprehensive overview. Next, I would like to introduce an esteemed panel we have in community and mental health segment. So if I say your name, please let me know you're there. And so the first one is Partha from Battle Creek. She's the executive director from Battle Creek Burma Center. Ta, are you there?
Yes. Hi, everyone.
Thank you. Next is Brenda Jacquity. She is from State of Michigan Office of Equity and Minority Health. Brenda, are you there? I saw, okay.
I think she may be having some trouble with the audio. But
yes,
yeah.
I saw Brenda waving. Thank you. Then we have our Congresswoman, Debbie Dingell. Hi. I saw Can you wave your hand?
I'm here.
Thank you. And next we have Senator McDonald. Senator?
I'm here.
Good. So this is the lineup for the segment, and we know from the literature we are not at equal risk for COVID-19, and certain individuals, for example, low-wage workers who have not had the option to stay home and keep our society functioning, they have a higher exposure and pose themselves in an increased risk for future infection. So we really need to watch out for these groups. Now we would like to ask Ta from Burmese community to share with us their residents and how their residents experiencing COVID-19 and their struggles. Ta, now it's your time.
All right. Good morning, everyone. I just want to say it's really an honor to be participating in this panel to talk a little bit more about who we are and our experience related to COVID-19. For those of you that may not know who the Burma Center is, we're located in Battle Creek, Michigan, and our mission is to really empower the Burmese American through advocacy, engagement, and education support. And we service, I believe, around 2,500 Burmese residents in our area. And so when COVID-19 hit, of course, kind of referring back to the discussion around hate crime, that was definitely one of the things that our community was experiencing in terms of the fear, because it was a Burmese family that was attacked in Midland. And so we did some work around educating our community about what are your rights regarding potential hate crime. And we work with Sunita. Good to see you again. And other things that we've done is that there's just been a lot of miscommunication or information floating on social media that was just really important for us to kind of debunk for the safety of our community. And so we done some health initiative working with local physicians around providing relevant factual information on how people can best protect themselves. And so as Dr. Su Ying mentioned, we experienced a significant number of Burmese people that tested positive, so much that Public Health in Kowloon County formed a new task force to help mitigate the spread of COVID-19 and to do more educational program for our community. And the reason being is that many of our people were essential workers, and so they were working in the meat plant industry. And I think we all have known and seen some data, JBS and Clemens, which is located in Coldwater. And so what had happened was that when people work, they tend to commute together too in a large van just because of the distance to get to work. And so not only were they being exposed, if one person was exposed at work, then they then risk the rest of the people that they were carpooling with. And each of those individuals then exposed it to their family. And so that's how the spread kind of occurred within our community. And so a lot of people during that time, because of the number of people that were testing positive, they were fearful, and so decided not to report to work until the work site had proper PPE. And it was just really impossible to even find masks or anything to kind of protect themselves. And so the Burma Center, we've gathered around making some face masks for people, delivering to those that tested positive, and also to some essential workers. As I was making some calls to some of the families, people who were exposed, who tested positive, one of the things that they shared with me was that it's a very lonely journey to be tested and to have a positive COVID. The fact that there's a lot of stigma already if you're Asian and if you indeed tested positive for it. And there's a lot of shame attached to it. And so a lot of people were not willing to forthcome and say, I needed support because my family just tested positive. And so, that was something that we didn't think about, and so one of the idea was, what would it look like if, public health call us and say, is there someone else, maybe a faith leader that we can call on your behalf to let them know that this is something happening and that they could probably offer some support to you. And so I thought that was a really good idea. Just thinking about how mental health can look differently for different communities, particularly in my community, many of us are Christians. And so having that kind of partnership with the churches and with public health and with their physician was something that came out of our conversation with these individuals. The second thing that I wanted to bring to people's attention when we talk about mental health is that internalized oppression is a real thing in our community, right? We talk about advocacy, but when you have people that are refugees that resettled here, speaking up for themselves is much harder, right? Like to know that, you know, you won't be penalized if you report to your employer that, you know, hey, you're not practicing the CDC guideline. You know, that's their livelihood. And so I think there's a lot of fear to say, okay, like you have the right to speak up, and that that you would be protected even if you spoke against, you know, improper protocol in your workspace. And so a lot of work that we have to do is really affirming our community, teaching them about what are your rights at your work location, but then also supporting them to say, you know what, you know, how can you advocate for the things that are not right? And so those were some of the things that we talked about. We talked already about language access being critical because the majority of them are first-generation immigrant with limited education. So language barrier is a huge issue for our community. And lastly, I think that, you know, something that I would like to contribute in the conversation again is around how can we prepare for the second wave, because we know that's going to happen. And there's just isn't a lot of guidelines, even for like the churches, like people are going to begin to convene again. How do we work with our non-native English speaker churches so that they have the proper CDC guideline to really make sure that their members are safe, because that's where they go to for their mental health support. And so there's just a question that I have for everyone that's attending today. Thank you.
Thank you, Ta, for this very vivid kind of observations, and giving that what you talked about, the stigma. And so earlier we shared the Asian Pacific Americans are not seeking mental health services because of various barriers, plus the stigma that you mentioned due to COVID. So these could exacerbate clinical manifestations. So Congresswoman Dingell, I know that you're very passionate about promoting mental health well-being and mental health. So can you please share with us mental health legislation and how our community, because we have a different unique needs, how our community could work with you to address these very critical issues?
Thank you. Thank you for having this conference. It's important. You know, as we begin the conversation, in the last month, last 90 days, it's been about 90 days now, 60% of Asian Americans have said that they have experienced someone blaming them for the coronavirus pandemic. And in 1 month, starting in mid-March, the AAPI reported 1,500 instances of actual physical harassment against Asian Americans. And that is a very stressful, it's a very stressful emotional event happening on top of the fear of COVID. We've got to work to address these issues. And that's why I thank you for the opportunity to focus today primarily on mental health. Mental health is something that impacts all Americans. And I'm especially concerned about it right now, when so many people have been at home, disconnected from community, that can spot signs of stress, tensions, and signs of mental illness. And that disconnection we worried about, and that people won't go for help or resources. One of the biggest problems we still have in this country is what you just talked about. People feel a stigma attached to saying they're depressed, to saying they're feeling scared or anxious, and they won't acknowledge it to anybody. One of the biggest problems we have in this country, and then we can take it to this community directly, is the inequity between mental health care and physical health care. For physical problems, people go to the doctor and they get a checkup. But too often, as we just talked about, people are afraid to seek out the care that they need, or they just don't know where to turn if they have questions. And what we have to do, it's not just legislation that you're talking about. We have to create a safe space where people can just talk about how they're feeling, you know, where they can turn if they've got questions. We know people are more likely to confront problems if they can find a safe space to do it. Science, practitioners, policy experts, and advocates agree We need to focus on prevention, early identification and intervention, integrated care and treatment, working towards recovery as a goal. These are the solutions I believe in and have been fighting for in Congress. Improving access to mental health care services, and which is what I'm trying to do legislatively, but I have to say that for me, one of the biggest issues I am trying to do for the broader community and for your community, where I think many feel like it's an even bigger issue, is reducing the stigma associated with care. I'm sorry, I'm losing my voice. It's just too urgent for so many people in this community and across Michigan and across the United States. The scope of the problem is staggering. 1 in 5 adults, approximately 43.8 million Americans, experience some form of mental illness in a given year. And that means just you're feeling anxious. By the way, I don't know about you, but I've been really anxious about COVID. I have felt that anxiety. People are depressed. Their lives have been abruptly uprooted. Young people across the country have been greatly impacted by mental health issues as well. In 2017, suicide was the leading cause of death for Asian Americans 15 to 24. 75% of mental illnesses begin by age 24, yet there are often long delays, sometimes decades, between the first appearance of symptoms and when people get help. Keeping mental health services in silos is what keeps people sick. Studies show early intervention is key to bettering mental health outcomes, which has many looking at the opportunity to offer help during primary care. On a positive note, we know already we've got the know-how how to treat most of these issues. Unfortunately, we have, as a society, have not made mental health a priority, and we've not devoted the necessary resources to ensure people have access to the services that they need. We need to invest more resources at the federal level, state level, and the local level in suicide prevention, research, and community health services so people have some place to go. Law enforcement collaboration is also critical to ending the stigma towards mental health and improving multidisciplinary community engagement. In closing, I want to thank you today for making mental health a discussion item. You all are on the front lines of talking to people. Everybody here is a leader in some way. We need to remove that stigma. And I think that this community is one of the communities that has particularly feels that if someone's depressed, if someone's anxious, if someone's feeling overly stressed by COVID or not performing, they're afraid to say anything. We need to keep people from not being afraid, and we need to help people get the support and the assistance they need. Thank you.
Thank you so much, Congresswoman Dingell, and we really appreciate it, and we will look forward to work with you in your office to continue this path. And now I would like to have Senator McDonald. We have some question coming in about people in Michigan are very anxious about the second wave. And since in the Senate, you are leading the community committee. So we would like to hear about state legislator. How do you address the second wave in terms of, in your power in the state legislature, and also about protecting those essential workers? Can you speak on these two issues?
Yeah. I like to thank Congresswoman Dingell for putting the emphasis on mental health. Not a lot of people know my background. I've got a doctoral degree in healthcare administration. I do sit on health policy for the state and health appropriations. I did a dissertation on obesity, and I found that there's just a huge mental health component to this. And she's completely right when she says that we don't take the mental health as important as we do the physical, but the mental plays a huge, huge role in our physical health. So I'd be happy to work with her on anything we can do at the state level to help. So I really appreciate that. In terms of the second wave, I think it's something we have to take very serious. I think that we need to make sure that our frontline workers are protected, because as we know, the trends, that this is probably going to happen. There probably will be a second wave. So it's something that we're taking very seriously in the state. Going back to my earlier statement about working bipartisan, I honestly don't think you can get anything accomplished if you don't. There's an old saying, if you're not communicating, you're fighting. So I want everybody to know here that I do work in partnership with my Democratic colleagues. And I do try to do what's best for my constituents, which is sort of a mix between Republican and Democrat. Actually, coming from Macomb County, we don't even really like Republican, Democrat. We are who we are. So that's one of those things. I've got a very large Asian community, and I couldn't be more supportive of them. They call me their adopted son sometimes. So just for the panel here to know that I'm always here for you if you need anything.
Thank you, Senator McDonald. Now we will have Brenda. Brenda is the manager for Office of Equity and Minority Health at State of Michigan DHHS. Brenda, can you share with us, earlier Todd mentioned about the very importantly language appropriate resources to help their community to learn about the regulation, to learn about protection. Can you share with us some of the resources that you could under the DHHS?
Yes, thank you, Dr. Wu. And good morning, everyone. Very happy that you invited me to just be a part today of the town hall. At the state level is really critical, and we're better to be a part of conversations like this because we're better able to develop messaging, policies, and programs to really understand what the community needs are. So I just wanted to quickly mention the Office of Equity and Minority Health, and that our mission is to provide a persistent and continuing focus on ensuring health equity and eliminating disparities for our populations of color in Michigan. And we've worked in collaboration and consultation for many, like Dr. Wu and others from racial and ethnic populations early on in this pandemic to get some direction in terms of what needs were. And one of the basic needs was making sure that information was translated. So we did that for a variety of resources in terms of how to mitigate the spread of the virus. I also wanted to mention just a couple of guidance that we put out. One had to do with culturally and linguistically competent recommendations, something that was focused for individuals, but also focused for providers, and asking providers to implement culturally and linguistically appropriate standards, creating resources in multiple languages, funding community-based organizations to serve as trusted community partners in developing approaches. So we've done a lot of that. And then just on the topic of mental health, we recently partnered with our Bureau of EMS Trauma and Preparedness and our behavioral health and forensic programs to develop guidance for providers around emotional health for racial and ethnic communities, really asking providers to consider culture, to consider traditional beliefs, to address social determinants of health, all of those factors. So those resources are on our COVID-19, the general page, but also on our page, michigan.gov/minority health. And then just finally, I'll mention that each year we give a report to our legislature. Public Act 653 charges the Michigan Department of Health and Human Services to create a structure to address racial disparities. So we, on an annual basis, give an assessment of that. We recently shared our 2019 report, and in that we looked at some data for each of the racial and ethnic populations, and is some data that I wanted to draw your attention to, because as we've talked a lot about COVID-19, we want to address some of those underlying factors, where you don't have access to care, how social determinants of health play a role in all of this. And there's some good data looking at the difference between 2010 and 2017 to see how each of the populations have either done better or worse when it comes to social economic factors, morbidity and mortality. So it helps to direct some of the efforts. But many resources, and finally, our behavioral risk factor survey, we conduct that for specific populations, so we'll know exactly what needs to be addressed. And our one for Asian and Pacific Americans are coming up, and we're going to make sure and do our best to disaggregate that data so we'll know what's happening with each of the populations within the community. Thank you.
Thank you so much, Brenda. And we have one question coming in. This is asking about, because in the APA community or any community where talking about anything related to mental health is stigma. So what are some of the suggestions that we could put it out there when this is not being discussed or, even bring it up? So does any of our panelists have some suggestions that how could we start having this more gradually open dialogue in this path? Brenda, either Brenda or Senator Madonna, if you have any insights, we'd love to hear from you.
Well, I'll just say quickly, in April, we did a town hall, and it was focused on reaching out to community-based organizations that we know serve racial and ethnic populations. We wanted to make sure we were getting information to that population. And we talked about stigma and knew that there were occurrences that was happening with the Asian and Pacific American population. And so speaking up, we encouraged community members to speak up, to report discrimination, and to show some compassion, to create opportunities, learning opportunities to dispel the racist information that was being put out there. So those were some of the things that we were promoting, and really as a community, coming together to say that we wouldn't stand for and support acts of violence. And mainly you have to learn, what's incorrect and then act on it and do something, encourage others to do that. And reporting is a big part of it. Thank you.
Yeah, I'll make one comment on that too. I don't know why mental health has a stigma at all, to be honest with you. The data is pretty clear. I'll share a very heartbreaking story. My wife's figure skating coach had a friend. He had been clean off of drugs for about 12 years. Once the lockdowns happened, he wasn't allowed to see anybody or get that community involvement, and he ended up becoming so depressed, he relapsed, and he ended up having an overdose and dying. So if you don't think mental health is real, I don't know what could convince you. It's a very real thing, and the statistics are very real and they're very clear. So,
Ta, do you have any other remarks? I know that in APA communities that when I was brought it up that sometimes that when people have some kind of mental issues, then our family member try to discourage, not to let them reveal because it seems like a family shame. So Ta, can you share some of your observations?
Yeah, thank you for the question. Yes, I think the Western model of mental health is it's not something that our people are used to or even have, right? So the concept of going to therapy, going to get help is foreign to us. And so traditionally how we have done is that, you will confide in your pastor, and the pastor will come and pray over you, and pray with you. Typically that's the way how we've done it. But there is definitely this idea of how do you say it? Like, don't air your dirty laundry out or something like that. It's very much like that. Like, you don't air your dirty laundry outside. You bring it inside and you resolve it and you hide it as much as possible. And that's a problem because then when you try to intervene, it's already been in the point where it's so much complication that it's hard to kind of really address the issue by the time it explodes, right? By the time we're made aware of. kind of going back to with this COVID-19 thing, one of the things that really broke my heart was that, you know, like I shared with you, you work with public health. And so public health were very concerned about the mental health of people, because the first question that the patient would ask them when they told them of their positive cases is, how long do I have to live, right? They think it's as a death sentence. And so they're preparing for death. And so then they're like, okay, that's not the case. Like, you might not die, but like, how are you managing your anxiety? How are you managing your stress? How are you managing, you know, not just being physically ill, but also like the economic stress of not being able to work, not being able to bring money in, right? And so these are the things that we're still thinking about, but we don't really have like concrete solution for, other than telling people that, hey, you know, we're here for you, but there is no bridge right now for us to even like support our people to get these mental health support other than their pastors.
Yes, indeed. This is a long path that we need to kind of jump the hoops, you know, one step at a time. And I have to be very mindful about the time. And I think it's a wonderful, wonderful discussion. Thank you for your contributions, and for all the panelists, and thank you all being there, you know, participating, hanging out with us. You know, right now it's more than 100 minutes. And so I think it's again a beginning. We don't think that everything will resolve, you know, at this town hall. Rather, we think that this is a seed that we are planting. And so for all the segments that we plan to look forward to work with all the stakeholders, all of our partners, to continue address these issues. So we will stay in touch, and Miriam would like me to remind people, we will send out the evaluation, because we do want to get your feedback. And like I said, if you have any issues that has not been answered, we try to go through our chat box and try to respond those questions. If not, please don't hesitate to be in touch with us. And again, that we really excited to work with you, and for continuing addressing these challenges in the months ahead of us. Thank you all, and have a nice weekend.
Thank you. It was a great,
Thank you.
It was a great event.
Thank you very much.
Thank
you.
you.
Thank
Whoever made
you.
that comment, that make us very happy.
Thank you.
Yeah. Thank you, everyone.
Thank you.
Thank you.
Bye now.
Bye.
Bye. Bye.